for doing this conversation. I was just wondering if you could tell us about your research at the moment.
Well, we've got 3 projects simultaneously on the go. I'm afraid all 3 might be considered controversial. The first, and we've published quite a bit on this, is changing patterns of neurological brain disease. And last year, we published a paper in Medical Hypothesis asking the question, was the increased background electromagnetism impacting upon human health? This, of course, is controversial because some people oversimplify it and say 5G, 3G damages your health, and that's much too simple. We actually start from a simple premise of reminding people that human beings evolved under 2 forms of radiation, solar radiation and the Earth's electromagnetic field, which is extremely slight. We all know if you have too much sun, you burn. The question is, can you have too much electromagnetism? And we believe the evidence is growing, yes, you can. And one simple way of looking at this is looking at America, who you might say is the very archetypal modern society, with its multiple industries, background, interactive environmental pollution with chemical from agricultural, industrial, domestic, petrochemicals, water, God knows what, food additives and so forth. And what we're saying is these changes in neurological diseases is not just one cause, but an interaction of a number. But we fear that the electromagnetism might have triggered the tipping point.
So the key thing to start with, perhaps, is what's happening to neurological diseases.
Yes. And
you're suggesting basically that a broad range of neurological deaths, which have increased considerably, are a result perhaps of this tipping point occurring.
Yes.
So what's happened with neurological deaths, would you say?
Well, the easiest way is to talk about America. Yeah, talk about America. 25 years ago, we're looking at 21 Western countries. And 25 years ago, America was the 14th highest out of 21. By 2015, all the other 20 Western countries have increased substantially. For example, Britain has trebled its neurological deaths. Right. But America is now 2nd highest.
And what do you say to people that obviously say it's because the population is aging?
Oh, this is all control for age and population.
Yeah.
When I was talking to some medical students and trainees about this, 1 or 2 were a bit skeptical and asking, searching methodological questions, as you're doing. Quite right too. So what I did, and I'd ask your students to do the same, I'd ask the men to stand up, raise their right arms in the air, and then point to where their mobile phones are. All my students and trainees mainly pointed to their pockets, all started laughing, and then I pointed out that they were bathing their gonads, their testicles, under 450 megahertz. That's never happened.
Yeah, that's radio. Those are radio signals, aren't they?
Exactly.
But isn't it the case that radio signals are relatively weak? If you look at the photon energy from radio signals, my scientist friend Dr. Keane tells me there are 1 million to 1 trillion times less than visible light.
Oh, absolutely.
So in a sense, the power is not that great.
Absolutely. But you see, unfortunately, your Dr. King is not thinking across the board. What he needs to think of is what's to change. 25 years ago, this level of electromagnetism in the background did not exist. It did not exist. And there's something called the Roscoe-Bunsen theory. It's not the level of radiation, but the prolonged but low frequency exposure. It's a long exposure. Right. In many ways, you could almost describe electromagnetism these days that if it was water, most of us are living in a very fine mist. A few of us are living in a drizzle, and some of us, occupationally, are living in a small shower.
Right. I mean, occupationally, do you notice a sort of epidemiological result in neurological disease? For example, I mean, you mentioned radar in your paper. Are the studies showing an increase in mortality rates of neurological disease near airports?
Yes,
where radar is used considerably, for example?
What is absolutely a very good question. There are four broad occupations associated with increased likelihood of neurological disease and ultimately death. But here's a slightly difficult thing, because this problem does not occur linearly. It all depends on your genetic predisposition. If we asked your students about their grandparents, and hopefully they're all alive, but if not, if you ask the students to think of what their grandparents died, you actually see family tendencies, no more than that. So what you've got is the occupation, the genetic predisposition, vulnerability, and then the environmental trigger. Because again, if you recognize that the brain is essentially an biochemical organ, it would almost be unthinkable if in fact electromagnetism did not affect the brain. And we're feeling that the current Goldilocks position of not too little, not too much is beginning to change in the balance.
Right. And what about MRI scans, for example? So MRI scans have huge doses, don't they?
They do indeed.
Relatively speaking.
But again, you're just looking at specifics. If you look at, people are
exposed to these, and they're not particularly harmful, are they? Otherwise,
well, it depends on how many you have. See, they used to say that about the X-rays. Yeah. They used to say exactly the same about X-rays. They used to say things about organophosphates. Unfortunately, we have to recognise that you cannot trust large corporations when it comes to the profit motive. You're an economist. You know that better than I do. Indeed. And you all have to talk about Volkswagen, who, to my shame, as a humanophile, cheated.
Well, and we certainly know about with cigarette smoking. It took quite a while to prove that smoking cigarettes was harmful. I mean, doctors used to recommend cigarettes, didn't they? But what can I just ask you a question about the WHO? Because they say that having looked at extensive research, but there's no evidence concludes that exposure to low-level electromagnetic radiation or fields is harmful to human health. Is that the WHO is saying?
No, it depends when that was printed and published.
Well, it's on their website at the moment.
It's on their website. This is why sometimes the problem may be, it's called the Precautionary Principle.
Yeah.
If you look at any publication post 2015, you're beginning to see more and more questions about this. For example, we know that electromagnetism can impact upon the cell and create oxidative stress. And again, it's what you need to develop these conditions is time. Now, when I looked initially at this is because suddenly a third friend of mine had died of motor neuron disease. And I remember from my student days, it was said to be 1 in 100,000. I suddenly realized in my professional career and my friendship, the third person. These increases in neurological deaths started measurably at the beginning, or rather the end of the 20th century.
Yeah.
Each year they've increased. And in this century alone, and this is where it gets really quite scary. Yeah. If you take Britain, in 2000, there were something like 26,000 deaths confirmed from neurological disease. It's now, can you believe it, 103,000 in the student century. In America, in 2000, it was something like 174,000 neurological deaths. At the end of the century of 2015, it's 430,000. Now, the other problem is early onset dementias.
Yeah.
So you're getting people now, for example, in Britain, and we perhaps should leave it to go to something else. In Britain, we have something called Young Dementia UK. This is a charity arise because of need. When I was your age, the idea of for example, one of my grandnephews was 34 and developed Parkinson's. I couldn't believe it. And then he's joined the young persons section of the Parkinson Society. There is a hidden epidemic of neurological disease, and it's really a question of government, what is happening.
Yeah, I mean, so you said that in the United States, is neurological disease the number 2 killer?
No, it came second highest. No, it's got from being 14th highest out of 21 Western countries.
Yeah,
it's now second highest. So it's overtaken all these other countries, which have also seen increases.
What about the view? It's a sort of philosophical question, if I may say, which is probably an epistemological problem of quite a lot of the research that you've maybe done, where it's an issue of cause and effect, that the correlation doesn't result necessarily in causation.
No. False correlation, the classic problem of false correlation.
Yeah.
Where we, if you like, rather naughtily get around this, because we're not just saying it's one factor. What we're reminding people that human beings are now living, and you can almost put a number on it. In the last 30 years, the immediate, intimate microenvironment for human beings has changed profoundly. You now have butter, which can come from the fridge and you can immediately spread it. Chemicals. You now have in our waters a range of heavy metals, all very minuscule. In women's breast milk, you now can recognize heavy metals and carcinogenic metals at very, very small levels. But in human breast milk, you then look at the numbers in almost your student's lifetime, the number of petrochemicals in terms of the number of cars, etc. They've quadrupled in the last 20 years. Aeroplane, and you mentioned about airports.
Yeah.
Airports admit quietly that there are some minor, they'll say, health problems, which they'll then say, of course, far outweighed by the economic advantages. Yeah. But it's when you pull these things together and have a time perspective.
So in your hypothesis really is that the background electromagnetic fields have become a tipping point.
May very well
depending on genetic predisposition.
Yes.
But you also, of course, talk about a multiple increase
in other pollutants.
And you say that people don't really examine the interactivity.
No, exactly. Not at all. One of the weaknesses of modern medicine, there is so much to know about my field of mental health, psychiatry, neurology, epidemiology, endocrinology, etc. And the medical expert who can cross 2 or 3 boundaries are extremely rare. And this is where I, as a social scientist in medicine, can actually make these connections.
Yeah. Well, on another issue which you raise, you mention autism and ADHD. And you say there's a significant increase in this compared to the 70s. But what about, isn't that really just a question of how it's measured? We improve diagnosis?
In the 19th...
people are aware of autism now, whereas in the early 70s, maybe people weren't aware. It's a chicken and egg situation.
Well, can I say this? It's what I call the comfort blanket of politicians who don't want to look at examining things which might embarrass them. And in that sense, I'm not going to be ashamed of saying this. When I was in practice in the largest county council in England, in the West Riding of Yorkshire in the 1960s, I was in child psychiatry. And we used to have probably 1 or 2 cases a year, which we then described as minimal cerebral dysfunction. We now call it attention deficit hyperactivity disorder, ADHD. It took 20 years to get 20 papers written worldwide on ADHD. The first one was written, I think it was, if I remember rightly, it was about 1964. Last year, when I was counting the number of papers worldwide, after September of 2019, I got bored when it was 750 papers. ADHD is now a massive problem, albeit a very soft and woolly diagnosis. Equally, autism. Again, I was in child psychiatry in the 60s and 70s. And yes, we knew these children. And they were there. And it was rare. there's now said to be 700,000 people with autism. Now, it's not that, and it's people like me who can look back over 50, 60 clinical years and say, look, we weren't dull. We knew a bit about autism in those days, only we ascribed it to psychological reasons, not what we now know, neurological.
But isn't there a lot of research to suggest it's genetic diversity? Sorry, it's a genetic core.
There's always a genetic element.
Yeah.
There's a genetic element.
Columbia University study that found that 80% of the likelihood of developing autism, I think, was down to a genetic component.
I wouldn't give it.
And people talk about neurodiversity as though it's a genetic given in many ways. Do you think?
No. I'm an unusual social scientist. I actually once wrote a paper about genetics and schizophrenia, which got me into trouble with some of my colleagues. But there's very few conditions which gives you anything remotely like 80% of a factor in a disease. There are one or two things like Huntington's chorea and so forth, but there's always a genetic element. Always a genetic element, which becomes complicated. And again, it's where you live, your locale. For example, there's also some research to show that autism and ADHD, there's a correlation, but no more than that, depending on parental occupations. And those parental occupations tend to be in the field of electronics, IT and electronics. Right. So again, there's these hints. But it's when you look at the big picture, there's something substantially changed. Right. I repeat, 15 years ago in Britain, 26,000 neurological deaths, now 103,000. There's something rotten in the state of Denmark, it was said. Yeah.
Okay, and of course, mortality is of great interest to you, like Durkheim, I suppose, and tells us a lot about society, perhaps. So coming on to COVID, I suppose, COVID-19, is it? I think your view. You've produced a paper on this recently. Is that right? And what? And
it's not yet publication. It's under review for publication.
Okay, and what does that say? If we can.
Well, oh my God, I might be agreeing with Donald Trump for the wrong reasons. What concerns me, and I'll share with your students, this has not yet been accepted, therefore it hasn't been peer reviewed. But I had the privilege of looking directly at research from Wuhan in China by this group of people who are looking at the first 2 months of deaths from COVID. I'll tell you what they found in a moment. I just wondered what had happened, because to me, at the initial stages of COVID-19, I said, well, yes, this is terrible, but it is, after all, a viral infection. So what one woman was beginning to hear was not surprising, because in the old days, we used to say influenza or pneumonia was the old man's friend. So what I did, I looked at 10 major Western countries and looked at their individual peak years of influenza deaths from 1979 to 2015. And interestingly, America's highest influenza deaths happened to be in 2015 and Canada's in 2013. Britain's deaths were highest in 1989, before your students were here. Having said that, we then projected forward, for all sorts of reasons, projected a number of deaths likely. Because what we found was, and you know what a correlation is, of these 10 countries, the pattern of deaths at their peak deaths of their influenza deaths were exactly the same. Between 80 and 85% of deaths were in people aged 75 and over, and the other 10% were people over the age of 55. So we're predicting, I hope I'm wrong, 47,500 deaths, and it looks like we might be coming close to that figure. Yeah. But on all, the ONS quietly said, but not authoritatively said, 91% of our deaths of COVID have been in people with diabetes, elderly are, respiratory disease underlying or Alzheimer's, namely the elderly.
Yeah.
And in Wahoon, where the COVID started, 85 to 90% of deaths were in people over the age of 75. So what we've argued, we should be having a vaccine for the frontline medical staff and healthcare staff, then people of my generation, because I'm officially have to shield. So I'm talking about my generation is clearly the most at risk. But I just wonder the macro psychosocial health implications of a decade of, according to the IMF, a worse economic turndown, since the Great Depression of the 1930s.
So the corollary of what you're arguing, is it that we shouldn't have a severe or stringent lockdown? Is that the corollary?
I would be saying what government should be doing should talk to the ONS and ask this question. What's the age of the people who've died?
Yeah.
I gather there's been 3 children die. Now, I can't think of anything worse than my children should die before me.
So
3 children out of 11.3 million.
So your view is that schools shouldn't close, is that right?
I would agree, yeah.
And is your view that we should have had what you might call
they shouldn't be. The pupils shouldn't be visiting grandparents or people, relatives with illnesses.
Because so is your view that we should have a semi-suppression, a little bit like Sweden, and not a full lockdown?
Exactly, sure.
Which we've had.
But to develop, until we get a vaccine,
isn't the problem with that if you had a semi-suppression, which is what we had at the start of March, really, the middle of March, didn't Neil Ferguson from Imperial College argue there'd be something like 250,000 deaths? And if we had no suppression or measures at all, we'd have 500,000 deaths, half a million. And surely that needs action.
No, you see, when you throw numbers around like that, what does John Donne say? Every man's death doth diminish me. Therefore, ask not for whom the bell tolls, it tolls for thee. When we did the first analysis, we actually said there'd be 602,000 deaths, which actually matched the annual death rate of 2015. But this is where it gets very nasty, and you've got to be, if you like, rather like a general. They talk about the war against the virus. In a war, there are casualties. A general, when he's playing chess, he will sacrifice a company, a regiment, a division. Our initial figures said there'd be 500,000 elderly people would die of my generation and people like me. That's just 1% of that age group. In other words, it's when you start looking at deaths and putting numbers on, but then it's really what's the proportion of deaths in this age population?
Right. But 500,000 deaths
would be 10% of our age group.
Right. I mean, that sounds incredibly drastic and harmful.
I agree. But then you see, in 5 years' time, most of them, people like me will be dead anyway.
Right. And what do you think of the costs of having a lockdown? So we've had a lockdown, and we still have had, because it was late, etc., we still have excess mortalities, don't we?
We do indeed.
Financial Times, it's something like, is it 66,000?
That's right, exactly.
I reckon.
For example, I've got a condition. I haven't been able to visit the hospital to check something of mine. So I might put myself at risk because I couldn't go to the hospital because of the COVID. Right. And what I would say is this: so far, more children have died because of lockdown in disadvantaged homes than probably ever will with COVID. So
in a sense, we're protecting the older population.
I'm afraid the cost of the young.
The cost-benefit analysis, if you like, is we're harming the young and maybe millennials, etc., to benefit obviously over 65s and to
Sure.
over 75 in particular.
Yeah. Which sounds hard, but you see, sometimes as an academic, you have to report what you find. And it may not sound morally nice, but you don't have a choice. We've now got an epidemic, a pandemic. So the real question is, how do we take, yes, tough decisions? Now, people like me should shield and continue to shield. There's no doubt about that. But most of the people don't need to shield, because what happened in China, most people who got COVID recovered.
Right, yeah. I mean, Neil Ferguson argues, I think, that if you shield the elderly, you'll still have 100,000 people dying because you can't shield them perfectly. He argued that if you try and go for perfection, you'd have something like 80% shield.
Look,
because, of course, elderly people have to visit hospital, etc.
Yeah, but can I say this? Yeah. As a society, it's almost, you know, you hear people, I heard, it sounds terrible to say this, but I am 84. I'm privileged to be still working and researching, etc. Yeah. But I have, as you know, I've got a heart condition, etc. I'm one of these high-risk people. But in this sense, you have to report what you find. And sometimes you have to take cost-benefit analysis and least damage. But you see, we had somebody go on the radio a few days ago, a few weeks ago. My father was perfectly healthy until he went into hospital, age 90, he got COVID and died. Well, he could have got an ordinary so-called influenza death. 90, you die. It's almost as if people don't expect to die. You know, we've got this. And of course, again, for the young people, they're over anxious about it. And parents shouldn't be anxious about their children. What they should be anxious about is anybody over 55 or anybody obese or a smoker. One of the things that we should be saying to the general population, if you're a smoker, you're at risk from COVID, you silly people. You shouldn't smoke. You've got an addiction.
Isn't it
vulnerable?
Isn't it the case? So a lot of economists like Jonathan Portis argue that there's not really a trade-off between suppression and the economy, but the two very much linked together.
Yes.
And that what you really want is a very, a steep suppression of the virus and of the economy, which we've had in March, and then you want to bounce back again. You want a V-shaped recession.
Absolutely.
So once you've got the virus down to low levels, you can have test, track, and trace, can't you? Surely, and isolate. And get that working really well, like the South Koreans. And then the economy can bounce back.
Sure.
Because the problem is, even if you don't have a lockdown, that people will automatically cut social consumption investment, and there'll be a fall in consumer confidence and a recession in any case.
Can I remind you as an economist? George Bernard Shaw once said in one of his plays, this politician was saying, we are the world's biggest exporters of strawberry creams, and his opponent said, that's what people want to buy, they don't need it. If they don't need it, they won't need our strawberry creams. And we now have an economy based on what people want rather than what they need. So I worry that we may have damaged ourselves significantly, because, can I say this, wasn't it nice of the government to think about we elderly people? Of course, most of the elderly people apparently vote Tory. I'm being cynical now. I'm only joking.
Well, the triple pension might be damaged, mightn't it? But the thing, looking at it from your point of your professional background as well, because I read an ONS recent report that suggested that if we had an L-shaped recession, so severe number of years, that 12,000 lives, they estimate, will be lost a year.
Yes.
How does that happen?
But look, it sounds terrible. Every man's death does diminishes. But look, you can't help it. Can I remind people there's a natural world there which takes no notice of human legislation or human morality. Cancer is a nasty disease. Asbestosis and COVID-19 is a nasty disease. Malaria is a disease. SARS, and we have to cope with it. The thing is, we need to cope with it to maximise the optimum for the majority. I'm a Benthamite.
Right.
Let's deal for the majority. And in this sense, as an 84-year-old vulnerable person, I'm saying I want to look after the under 30s.
Right, yeah. And okay, if we look at things such as school closures and the lockdown measures, how do they harm society, and how do they harm people so much? But recession, how does it harm people so much but it results in lost lives?
Well, what you've got to start with, you've got the economic situation. Parents can't go to work because they have to look after their children, and so forth. But equally, you see, and I'm looking at my social work background now with vulnerable families. Can you imagine what it must be like into a marriage which is not particularly successful and so forth, and potential domestic violence? We all now know that domestic violence has gone up, etc. I say more children will have died from neglect and abuse within certain types of homes than will have died at all from COVID. No, we have to recognise that we do not have a choice in the challenges that nature throws at us. And if, of course, we've been mucking around with nature, then nature will bite us back.
Right. And people do suggest that in terms of COVID-19, that more pandemics could occur in the future.
Can I quote
environmental harm?
You know, the biggest scandal, Mark, the biggest scandal is the World Health Organization 5 years ago warned them a pandemic was coming and you're not ready for it. We said they didn't know where it was. They knew it would. They assumed it would either be from Asia or Africa. There's another pandemic brewing, and that is multiple drug-resistant bacterium.
Yeah.
And amazingly, there's now only 3 antibiotics which will kill anything. 10 years ago, there were 5. But of course, there's no profit to be made out of developing antibacterial drugs, because once you give somebody a course of treatment, they're cured after a week. So there's no profit in it. Whereas in my field of mental health, where you're giving people drugs for a long, long time, there's a lot of profit in that. And the WHO has already warned us that, you know, we're on the brink of where we will not be able to do surgery as we understand it, because the multiple drug resistant bacterium will have circumvented and evolved to no longer react to these 3 left major antibiotics.
I'm sure there was a significant breakthrough 2-3 weeks ago at Imperial College or somewhere like that in terms of developing new antibiotics.
Well, I'm pleased to hear that.
Which is extraordinary, isn't it, that we use antibiotics in such a prolific way?
Well, of course, I don't talk about the other thing, but guess who's got the highest rate of sepsis in the Western world?
Well, you probably say your friend the United States.
Your friend, my United States. And why? Because we've just done this paper where we quote, most of the time we're quoting American researchers screaming their heads off saying, look, our food processing, our animal welfare is producing the highest rate of food poisoning deaths in the Western world. Their sepsis deaths is almost double any other Western world country. And why? Because they're feeding their meat and God knows what, not only chlorinated chicken, but pushing antibiotics into their beef, cattle and everything else. It's a scandal, absolute scandal.
And coming back to the previous scandal, I know you've written key research on suicide, and I think as in 2018 was a high. Britain had 6,500 suicides, something like that. In what way would you say unemployment and recession is related to suicide?
Durkheim and I agree on this. We looked at Durkheim's original data and followed it up in 50-year periods. And over the 150 years, we found the same pattern, have an increase in unemployment, and suicide goes up as well. But thinking of a time, can I say something about Black Lives Matter?
Yeah.
Because this is our research, which we've not yet submitted, but I'm actually finishing off today. And I'm actually emotionally disturbed about it, because it's quite clear that in the United States of America, relatively speaking, Black lives do not matter. What we've looked at, based entirely on American data, their national vital mortality statistics, they have 5 ethnic groups: African Americans, whites, Hispanics, Asians, and Indian Alaskans, and there's only less than 1%. There are only about 13.2% of Americans who have an African American heritage. And what do we find? We find that of the 33 major death categories, the Black Americans are highest in them and the Indians, the two most disadvantaged economic groups, are highest in 24 of those conditions, and then second highest in 18 of them. Oddly enough, or not oddly enough, Hispanics and Asians are highest in nothing. And the Asians are significantly lower. And when we give you some idea of how bad America is, in earlier research we showed that for America has the highest child mortality rate in the Western world, bar none.
And then relate to inequality.
Related to equality. The correlate, because America's got the highest internal relative inequality in the Western world. We can't boast in Britain. We're the third highest, third worst relative income inequality, and fifth highest death rate of children, 0 to 4. That's a scandal. And of course, government doesn't want to talk about this. The government doesn't want to talk about it. Don't get me on that, whatever you do. The thing of the Americans, and one American colleague said, "Oh, but Colin, you're including the blacks." I thought, oh my God, is this from South Africa? I'm hearing this. So what I did, I looked again at white American child deaths. And sure enough, white American child deaths aged 0 to 4 are the highest in the Western world. But for every white child who dies in America, 2.1 black children die. Right. They have a child mortality rate double their white brothers and sisters. Right. Now, when it gets to total death rates, if the African Americans match the Indian death rate, which is the second highest in America, there'd be 18,000 fewer dead African Americans out of the current 320,000. If Black Americans had matched white rates, there'd be 44,000 fewer Black American deaths. If Black American deaths had matched Hispanic Americans, there'd be 130,000 fewer deaths. And if they'd have matched the Asians, it would have halved their death rate. And the average of these ethnic groups, if the Black Americans had matched them, there'd be 75,000 fewer dead Americans. When you go into the American statistics very carefully, there's a classification called legal intervention, which really is about executions and people being killed lawfully by the police. And their average for the whole of America is 2 per million. Bearing in mind there's 322 million Americans, 2 per million means there's 600 deaths a year killed by policemen. However, when it comes to Black American males, their death rate is 5 per million, which is actually higher than the average murder rate in this country. Yes. I'm afraid to say, in America, Black lives still don't matter enough.
And another thing connected with this a little bit is the deaths of despair work by the economists Anne Case and Angus Deaton. And they argue that long-term socioeconomic effects of course, is it in 2017, 150,000 deaths? Basically, they argue that there's an actual increase in a fall in life expectancy, I think, of non-Hispanic whites without a college degree. So the education is the key thing.
Let me say something.
And some of them might be Trump supporters. But
can I say this? I shouldn't be saying this. May sound controversial because every man's death does diminishes, and I believe very simply, alle Menschen Bruder and Schwester. all men, we're all brothers and sisters, irrespective of your gender, your sexual orientation, your ethnic background, etc. That is something I feel passionately. I was brought up, even in the 40s, as an internationalist. The world is full of human beings who are all brothers and sisters. Here's the paradox. I can almost say why President Trump got elected. Not the fact he was a TV comedian like Lord Alan Sugar, but because 25 years ago, Hispanic American death rates were very similar to Black American death rates.
Yeah.
Now they're considerably lower. In this country, we have got progress, not enough progress, and the number of Black people dying in police custody is frankly a chronic scandal. Of that there's no doubt. But here's the paradox. If you look in our British universities, you've now got 53% of our students are women. Massive change. Massive change. In our general surgeons in Britain, 17% of the consultants are women. Now, not enough, but an incredible change. In our universities, we've now got more proportionally Asian students compared to the general Asians in the general population, and actually more Black British students, I'm pleased to say, than in the general population. The missing groups, the really missing groups, are white working class lads. And this is what feeds this sense of left behind. This is what I think fed the Brexit vote, fed the Trump vote.
Well, the other crucial thing, I mean, Deaton calls it the deaths of despair. I mean, in a sense, it's the deaths of globalization, isn't it? And deindustrialization and moving, which you mentioned earlier, towards a service-based economy. When you actually look at what's happened with COVID, the service-based economy is rather big, at least in terms of hospitality, for example. It's had a significant effect, I suppose. So what are the implications of your... So the implications are a lot of this depends on the quality of government.
I'm afraid so. We tried to avoid politics. There's a man called Keir Starmer who's virtually saying his question for Prime Minister is, Mr. Johnson, stop blathering. It may sound amusing for a time, but you're no longer a comedian. You're supposed to lead the country. And we want effort on detail and specifics. Well, unfortunately, Mr. Johnson is weak on specifics. But what I can tell you is this, what really worries me. You mentioned about deindustrialization. I'm a miner's grandson. I was brought up in a place called Castleford, which had almost more coal mines than anything else. On the other hand, I was considered a sissy because I didn't become a miner. On the other hand, if I had have done, I wouldn't have got to 84. But having said that, I remember when the collieries started closing, men whose identity was their masculinity, and they're the elite. And, you know, when you go into the Second World War, we've had all this boom-ha and jingoism about the Second World War, etc. Men were sent down a coal mine very often rather than down in uniform to fight because coal mines were that dangerous. And suddenly overnight, literally within 2 years, miners were suddenly taking their identities away from them. What a man or a human being, man and a woman now, without a sense of purpose is despair. And it's both men and women. And what is interesting, I could almost say to my feminist colleagues, look at the progress. Oh yes, there's still work to be done. But unfortunately, women are now suffering as men suffered. Women unemployed can start feeling the same despair as men did. And I hate to say this, as a personality, I'm a kind of an optimist, but I fear for the under 30s, because it not only is COVID a nuisance, but it's going to be like a Sunday school party compared with climate change. And this will be my last moment of doom. In 1964, okay, before you were born, my wife and I stood in front of the largest glacier in Western Europe, the Grossglockner. And over the intervening years, we saw it retreat up the mountain. and the year before Beryl died, it had disappeared. I saw the Fox's Glacier in New Zealand, half the size it used to be. You look at Greenland. I remember first time I flew over Greenland, it was totally white. Now you fly over Greenland at the wrong time, a third is green. Yeah. The speed of these changes of climate change.
Maybe we shouldn't be flying over Greenland.
Exactly. In May you had July.
Yeah.
That's climate change.
Yeah.
I've had roses growing in my garden in south of England throughout each month. My sister-in-law in Middlesbrough on the east coast, you know, I nearly said you Southerners won't understand how cold the North Sea coast can be. But she had roses last December in her garden. So, here's a challenge for you.
Yeah.
Science and education is our only hope.
Indeed. So
and humanity, and a common humanity, and a liberality of spirit, and an inclusivity of spirit. Go forth with your brothers and sisters wherever you find them.
Okay, well, thank you very much indeed. Thank you very much for giving up your time.
My pleasure.
Very kind. Thank you. I was